First at 6 tonight, birth control easily in the hands of women. That is the goal of a new app launched across Texas this week. It is changing the face of medicine for doctors and patients, and it's made possible by a change lawmakers made just a few weeks ago. KXAN's Gigi Barnett explains.
No more face-to-face doctor visits, exams, or trips to the pharmacy to get this. Birth control in Texas. A new app launched statewide this week allows women to answer a questionnaire, get a prescription, and days later the pill arrives at her front door. It's called the Nurex app, a game changer for low-income, minority, and rural-based women.
Accessibility is always a good thing.
We were getting hundreds of messages from patients in Texas.
Dr. Jessica Knox is the medical director for the California-based app. It comes at a time when the state just expanded its telemedicine laws, which opens the door for patients to chat with a doctor on their computer, smartphone, or tablet without an initial face-to-face visit. Knox says because a woman who's 18 and older can talk with a medical professional from the comfort and convenience of home, patients are more likely to use the app and open up to doctors.
We also have had patients tell us, I feel way more comfortable talking to you and asking you sensitive questions.
But opponents of patients ordering prescription drugs through an app without personally seeing a doctor first fear a spike in misdiagnoses. Knox says birth control is a safe medicine. Plus, with the click of a button, patients can get back in touch with a doctor for follow-up questions.
A lot of doctors aren't comfortable with changing the model so dramatically, but our model needs to change.
Right now, the app only offers several forms of birth control, emergency contraception, and HIV prevention medication. It plans to offer other prescription drugs over the next few years. Gigi Barnett, KXAN News.
Dr. Knox says the Centers for Disease Control does not recommend an in-person doctor's visit before a healthcare provider can prescribe birth control. Just this last session, Texas lawmakers reversed a rule they adopted in 2015 that said doctors could not video chat with their patients unless they've previously met with them in person. That meant millions of Texans living in rural towns were forced to drive hundreds of miles in some cases to see a specialist. Women in 2 states don't need a prescription for birth control. It is available over the counter in California and in Oregon after filling out a brief questionnaire and having a quick consultation with a pharmacist.